Hello everyone, welcome to GrowMed. In this video, I will be discussing some PYQs which were asked in the recent July 2025 exam. So I'll give you a brief overview of what all we will be doing in this video. So I'll discuss the MCQ, and along with that we will discuss what is the right answer, why it is right, and along with that everything related to that topic. So that if at all a question is asked in the future exams from this topic, you will get it correct. So uh, we will be discussing 5 MCQs, 5 PYQs, and along with that, the whole disease aspect. Okay, so the first question: a patient underwent parathyroidectomy, and after post-operatively, he complained of excessive sweating and redness over the parotid region. What is your diagnosis? So look at the options from this one. The correct option is the Frey's syndrome, which is also called as a auriculotemporal syndrome. Because what happens is this syndrome is whenever you see these things in the clinical case, the parathyroidectomy or the parathyroid region post-operatively, think in terms of the Frey's syndrome. What happens is that gustatory sweating on one side of the face due to misdirected auriculotemporal nerve fibers. So this is the pathology, and if question is asked why this happens, you need to answer this one. Okay, followed by parathyroid injury. So these are the clinical features which are described in the clinical case here: excessive sweating and redness, and the management is the Botox injection, the surgery, or the scopolamine ointment. So this is about the Frey syndrome. The hint words which you must know or the buzzwords is auriculotemporal nerve fibers, gustatory sweating, redness, and parathyroid surgery. So these four words will be directing you towards the Frey's syndrome. Moving on to the next question about the Wilson's disease, again a very important topic. So what is the gold standard diagnostic test for the Wilson's disease? So from the given options, the liver biopsy is the correct answer. If they ask about the screening, then it will be 24-hour urinary copper. So you need to read the question very carefully what is being asked. So here in the question, gold standard is being asked. That means the liver biopsy. In that we will be looking at the copper, the amount of copper present in the hepatocytes. So about the Wilson's disease, it is an autosomal recessive disease, and the gene mutated is the ATP7B PYQ. This was asked in the past years. These two images were also asked in the past years. So the clinical features or the buzzwords which you must remember for this Wilson's disease is the KF ring, the sunflower cataract. You can see here in the image, the sunflower cataract, and the increased ceruloplasmin. Whenever these three things are given in the clinical case, blindly mark the answer as the Wilson's disease. So again, two important questions related to this one. Investigation screening is the serum, increase in the serum ceruloplasmin, and diagnostic is gold standard is this liver biopsy. So yes, I think all the things related to the Wilson's disease are clear here in this, and I hope you will make all the questions correct related to this disease. Then moving on to the next PYQ, which gene is mutated in the Marfan syndrome? Again, a very important topic, Marfan syndrome. The fibrillin 1 gene, collagen type 1, laminin, and dystrophin. So in this, the fibrin 1 gene is mutated, and this one is the answer. Okay, so the correct answer is the fibrillin 1 gene. Now, various other things about the Marfan syndrome which you must remember. It is an autosomal dominant condition, and the gene mutated is the fibrillin 1, where it is present on the chromosome 15, and the protein defective is this fibrillin. So the pathology behind this one is that due to the defective protein, the microfibrils are also defective, and due to which the abnormal elastic fibers are formed. The clinical features will be described something like this in the clinical case: the mitral valve prolapse, and it is the most common cardiac abnormality, a PYQ. Remember this one. Then aortic dissection. This is caused due to the aortic aneurysm. It will dilate and cause dissection, and this is also the most common cause of death in the patients with the Marfan syndrome. Retinal detachment, again another important buzzword which you must look into the case. Joints are freely movable, or it can also be given as the flexibility of the joints or hyperextensibility of the joints. Then arachnodactyly, which is also called as the spider finger. Pectus excavatum, that means the pigeon chest. Then high arched palate and ectopia lentis, that is the dislocation of the lenses, and mostly the superior temporal dislocation of the lens is associated with this Marfan syndrome. So remember these clinical features, and when you see these things in the clinical case, think in terms of the Marfan syndrome as the answer. Then the next MCQ, again a very important and a repeat topic asked multiple times. Which enzyme deficiency causes lethargy, hepatomegaly, and cataracts in a breastfed infant? So this is a classical feature of this galactosemia and a very important disease. And I think this galactosemia is question uh, topic is repeated in every exam. Questions are either asked image based questions on the cataract, the oil drop cataract which is seen, or the clinical cases, or the question asked in the December 2022 is the breastfeeding contraindicated in the galactosemia. So these are the questions asked in the galactosemia. So see here, the now we will discuss about the MCQ which is asked here. The enzyme deficient is the galactose 1-phosphate uridyl transferase. The short form is this GAL put, and the enzyme deficient is this one, galactose 1, already discussed. Now accumulation of galactose 1 phosphate occurs, and due to this various clinical features are seen like failure to thrive and intellectual disability, because this content is getting accumulated in the brain causing disability. Jaundice, because it is getting accumulated in the liver. Hypoglycemia, vomiting, and oil drop cataract. So these are the clinical features described in the clinical case, and these are the types of the galactosemia. Type 1 is the classical type, and it is the most common variety seen. Type 2 galactokinase deficiency will be seen in this one, and type 3 galactokinase epimerase deficiency will be seen. Then breastfeeding is contraindicated in case of galactosemia, and the management is to exclude galactose and lactose from the diet. Use soy-based formulas. So yes, this is about the galactosemia which you must remember. And remember oil drop cataract, whenever you see this in the clinical case or the question asked, galactosemia is the answer. Then last MCQ for today's uh, video, and we'll discuss it. Male develops diarrhea after 3 hours of eating salad and milk cheese, and no fever is seen. What is the likely causative organism? So the things described in the clinical case are mostly deriving us to the Staphylococcus aureus from the given options, because the incubation period of the Staphylococcus is usually between 2 to 6 hours, and it is most commonly associated with the milk products, and it does not associate with the fever, and vomiting is the most common mm, uh, feature seen with this one. Okay, so see here three buzzwords, and Staph aureus is the answer. So these are the various other hints given to identify which kind of poisoning it is. In the Staph aureus, the source is cream, milk, and pastries, and these are the clinical features: vomiting, no fever, and the incubation period. B series associated with the fried rice and the Chinese, and the incubation period is usually 6 to 8 hours, 8 to 10, something like this. Okay, it will be seen after the 6 hours. Then Clostridium perfringens, reheated or the uncooked meat or the raw meat, and diarrhea and abdominal cramps, the clinical features. Vibrio parahemolyticus, this was asked in the exam in I think January 2024, and it is associated with the seafood. They'll be given like fish or consumption, any oyster, something like this will be described in the case. Diarrhea and abdominal pain. Salmonella, egg, poultry, and fever and diarrhea are the presentation. Then Shigella associated with the salads and the water, and it is associated with the bloody diarrhea. So whenever you see this in the clinical case, the bloody diarrhea, think in terms of the Shigella or E. coli or this Campylobacter jejuni. Then E. coli contaminated water. This is a buzzword. Whenever you see the contaminated water and then the history of some diarrhea, then think in terms of the E. coli. Campylobacter jejuni, poultry and milk fever and bloody diarrhea, and listeria monogenes associated with the dairy products, fever and meningitis is this clinical presentation. So yes, we have discussed the 5 important PYQs and the repeat topics which were asked frequently in the exam. I hope this video was helpful to you. If you're new to GrowMed, subscribe to GrowMed, like the video, comment below, and share it with your friends. Thank you so much for watching this video. All the best for the exam.